Welcome everyone to today's session. Before we start, I would like to thank ECA, ADIC, SPIA, and MOA for their support in putting on this training to ensure children and their families are kept safe when nurseries reopen. We understand you may have questions relating to the guidelines. While it is hoped the training will address most of these, if you have any questions, please type them in the question box here along with your licensing authority, and after the training, the most frequently asked questions will be forwarded to the appropriate licensing authority. Please visit kinderly.ae/TheQueen, where you'll find the Q&As updated regularly. After completion of the mandatory sessions, you'll be required to upload your operational plan to the link that will be shared on the third session. There will be no assessment for managers. Today's trainer is Lara Hudson, who's a director of a chain of nurseries in the UAE and also an experienced trainer and mentor. Lara, the floor is yours.
Hi Rafi, and thank you for the introduction. Good evening everybody, and welcome to part 2, Operating Safely and Implementing Government Guidelines numbers 4 to 9. Let's have a quick look at what tonight's training process will look like. So as you've probably noticed, we've put everybody onto mute tonight to ensure the listening experience for all attendees. As Rafi has just mentioned, there is a chat function at the top of your screen. If you do have any questions or you need any clarifications, please do ask your questions here, but do make sure that before you write your question, you write which licensing authority you wish us to address that question to, so that we can make sure that we get the right information from the right people for you. There is an information forum over on the Kinderly website, so you can find that at www.kinderly.ae/TheQueen. Within that information, there is a frequently asked questions document that is regularly updated with the answers to the questions that we've had in previous sessions. So it may be that your question has already been asked and answered over there. So please do go and visit that website and have a look at the information that's available there for you. It may just be that that's what you're looking for. The sessions are being recorded, and these recordings will be uploaded to the Kinderly website 24 hours after the session has been carried out, and these will be translated into Hindi and Tagalog for your information. As I just mentioned, tonight's session is part 2, and we'll be looking at guidelines numbers 4 to 9, and those are mentioned there for you. We're going to work through to the guidelines tonight. We're going to look at what the documentation says, and indeed what you need to upload onto the portal to apply for your NOC. After today's session, it is anticipated that you'll be able to have a better understanding and familiarity with these operating guidelines and the documentation that surrounds them, that you'll understand your responsibility as a leader in ensuring the safety of children, their families, and of course your staff team in relationship to the guidelines that we're about to work through. That you'll understand how you need to implement these and reflect on what goes on in your setting and how you could manage these guidelines within your setting. And that's supported also with the self-assessment form that's in place. And then hopefully you'll complete guidelines numbers 4 to 9 on the operating plan, ready for your upload to that portal. This is an overview of the 9 different guidelines for you. I'm not going to read through them. You have them all in the documentation that you should have with you. That really is just for your reference. As we mentioned in part 1, you should have 5 documents with you. You should have the reopening operational plan, the guidelines document themselves, the reopening operational plan manual, the reopening plan template, and that's a really important document because if you download that in a soft copy, and it is available on the Kinderly website, you will be able to complete the sections of that as we go, and then it really is ready for you just to copy and paste into the portal as soon as you're ready to do so. I would also suggest to you that you add a file onto your laptop and that you put in there all of the different supporting documents that you feel you're required to upload. So those would be your policies and procedures, your checklists, your risk assessments, your trade licenses, your educational licenses, again, so that when you come to the portal, it's very, very quick for you to do your upload. You'll also have a roles and responsibilities document. Again, you need to read that with the operating guidelines document to get that complete picture. None of these documents really should be looked at in isolation. And last but not least, you should have the self-assessment document, which again allows you to reflect on where you are as a setting and how you wish to move forward with your planning for the reopening. So tonight we're going to start with guideline number 4, and before I get started, I'd just like to highlight to you that at the top of the slides it either says mandatory or suggestion. Those that are mandatory, they tie in with the guidelines where it says nurseries must. So those slides link to those nursery must guidelines. The suggestions really are just that. There is an area within the guidelines that says things nurseries should consider. And that really is, again, the linkage there. Those suggestions are the things that nurseries should consider to put in place. So guideline number 4 looks at social distancing. So as we move forward, it's important that the nurseries create bubbles, and these are groups of children and staff that will remain together for the duration of that day. It's important that you ensure that there is no intermingling between your bubbles, and that means that the staff shouldn't be mixing and the children shouldn't be mixing with children or staff from another bubble. Within your setting, if you have children from 45 days to 2 years of age, you can have 16 children registered to a bubble, with 8 attending in any one day or any one session. And it's important that you note that in your 2 to 4-year-old bubbles, you can have up to 20 children registered and 10 being able to attend in that day. So those are really important numbers for you to remember. It's also important that as we put our bubbles together, we think about the children of working parents and that we give priority to these so that they can ensure that they can work and they have that care in place for their children. When you're also setting up bubbles, I strongly suggest that you think about putting in your 5-day attendees first, because they're easy to place in bubbles, and then you work your part-time attendees around it. It's just a much easier way of putting your bubbles together when you come to looking at the logistics of it. It's important as well that within your bubbles you ensure that the age requirements are met. Normally, most nurseries would consider doing things like the 0 to 1, 1 to 2, 2 to 3, and 3 to 4 years age grouping. Under the current restrictions, you are able to group together children who are 45 days to 2 years of age. So they can be together in a bubble. And you can also bubble together children aged 2 to 4 years, if that again works in a better way for your setting. It is important, though, that you do maintain those numbers, so either 8 children under 2 or 10 children over 2 in any day. When you're looking at the allocation of siblings, you can allocate siblings to the same bubble, as long as they fall within your age groupings for those bubbles. It's important as well that when you're thinking of where you're going to place your bubbles and the way that their base rooms are going to work, that you think about the practical arrangements that you have in place to minimise the transitory crossings. So that's when the children are moving together in a corridor. Again, we're trying to reduce all of that contact between bubbles. So think of ways that those transitory crossings could be managed so that you only have one bubble in a corridor at a time, for example. Once you've assigned children to your bubble, it's important that you understand that these children cannot be moved until the licensing authorities lift these restrictions. If your nursery is an open plan setting, it's important that you think about how you're going to make the spaces for your bubbles. You must ensure that when you're putting things in place, that the children don't mix in any way. So looking at the ways you use your space and you use partitions to ensure that your space is managed well and those bubbles are not mixing. So this table highlights to you the staffing requirements. Again, it highlights to you the numbers in the bubbles and the numbers of registered and the numbers of attending. If you have children 45 days to 2 years of age, for every 8 children, you will need 1 nursery supervisor or a nursery supervisory assistant and 1 nanny. And you will also require an extra person, an extra staff member to be assigned to that bubble. With your bubbles of 10 children aged between 2 to 4 years, you'll need to have a nursery supervisor assistant, and again, 1 extra staff member assigned to that bubble. It's important that you understand that your setting can organise these roles as you see fit to do so. However, when you're looking at it and you're thinking of minimising that cross-infection and thinking about how you're going to staff it, think about how that extra person could be used within your setting, within that bubble, as a runner or as a cleaner. So could they be the person that collects the children of a morning and makes sure that their bags and shoes are sanitised, that brings them to class and makes sure their lunch boxes are sanitised and hands them over to the bubble staff who can then go and get on with their day? Once all the children have arrived, could that extra staff member become your cleaner so that any resources that are used are moved out of the classroom, cleaned and then returned back to the bubble room so that they can be used again as required? Think about how you can get the maximum usage from the different people that you have in the buildings in terms of how they can meet the guidelines and the requirements that you have, and think about how you're going to minimize that cross contamination and make sure that everybody's kept safe. You also need to consider how you're going to manage your staff absences. If somebody's off, who will cover for them? Do you have additional staff available? And just keep in mind that once they've worked within one bubble, they will be unable to support any other bubble. Again, think about people like your admin team. Could they be ready to step in an emergency or in an absence? Could they perhaps step into that cleaner or runner's role so that you have that additional support, but they're not actually really spending much time within your classrooms? Again, it's a case of thinking through the practices within your nursery and how best you can manage those. It's also very important that you remember that you do need to maintain the ratios of your qualified staff on site. So again, just keep that in mind as you're starting to put your bubbles together. If you do have fewer than 8 or 10 children attending on one day, then you can reduce your staffing accordingly. So if you had half the number of children, you could reduce the staffing down in your bubble in ratio to that. Just keep in mind that once you have started to operate, your bubbles cannot be changed until the licensing authorities lift the current restrictions that are in place. So you do need to be sure that when you're allocating staff and children, you're doing it in a way that's going to be workable in the future, because there can't be changes made once those children are in and once you're operational. Make sure that all of your staff are allocated. This includes cleaners to specific bubbles, and that they do not rotate and change between bubbles under any circumstances. Ensure that within your staffing, you highlight the importance of physical distancing of staff so that the staff congregate only with those from their assigned bubble. You need to have physical distancing of adults from other bubbles, and they need to remain 1.5 meters apart at all times from those who have come from other bubbles. It's also important that you highlight to your staff team before you return back to the setting, so in your pre-opening training, that staff cannot leave the nursery property during the working day and until their duty is completed. Should they need to leave, if there was an emergency and they had to leave the building for some reason, they need to understand that they are not allowed to return until the following day. So again, just a case of communicating that and making sure your staff are fully aware of this. Also, before you return in your reopening training, communicate to your staff their bubble allocation and your expectations of the role that you want them to assume within their bubble team. Keep in mind that once you've allocated those staff members, they cannot be moved to another bubble. Make sure that as you look to manage your team in the weeks ahead, that you keep in mind the social distancing measures and that those are a consideration at all times. So when you're planning your break time schedules and routines, making sure that you have the distancing within your staff room environment if you don't have that in place, explaining to staff that they may need to take their breaks in the classrooms, in their bubbles, and also making sure that in between you have that time for cleaning between the usage of that staff room space. It's also important that you understand the square meterage and the spacing within your setting and in your outdoor areas so that you make sure that your bubbles have the adequate amount of space. For example, if you don't have enough outdoor space, the 5 square meters per child in your outdoor area, that again, you reduce the number of children from one bubble that uses that space at a time. So perhaps you put half a bubble into your outdoor space and then they swap with the other half of their bubble. Again, so that the space is adequate to the number of children that are using it. Make sure that your bubble base rooms, so your classrooms, are clearly labelled with your bubble names. And again, you may want to also consider listing the staff or putting up photos of the staff that are in that bubble room, and perhaps even the children if you have photo consent to do so. Make sure that at the beginning of the day, as the children and staff arrive, that they have everything in that base room that they're going to need, including what they need to eat and sleep. Children will be eating and sleeping in their base bubble room. Communal areas shouldn't be used by different bubbles during the same day. It's important that between the use of a communal space by different bubbles, that you build time in for it to be cleaned and sanitized, and then it needs 24 hours before the next bubble is allowed to use it. Bubbles must not share sleeping space and equipment, and they mustn't share an eating space and equipment. Your toilet facilities and your nappy changing areas must be cleaned in between use of different children. So again, your bubbles should be using one specific area that's for their toileting and for their nappy changing. If, for example, you have a shared bathroom or a shared nappy changing area, make sure that you split it into different bubbles allocations. So if you had 4 toilets in a shared bathroom, you would allocate 2 toilets to one bubble and label those, and allocate 2 toilets to another bubble, and again make sure that those are clearly labelled so the staff and children are aware of which toilets they can use. It's important that at the beginning of the days and at break times that you stagger schedules, you stagger entry into the buildings and you stagger pick up and drop off. So again, you have those social distancing measures in place. Again, at break times, you make sure that the bubbles are using communal staff areas together with other people from the same bubble. And that, again, those times are staggered so that we have those social distancing measures in place. And again, we've minimized the transitory crossings between different bubbles. Parents must come to the nursery one at a time. So again, staggered arrivals and staggered pickup of children. If you have a nice spacious outdoor area, you may want to consider dividing that space up so that you have space for the different bubbles to use it, rather than having one communal space and having to have that 24-hour gap in between. And make sure that your signage is clear and concise throughout your settings, and that the language within your signage is clear as well. Considering what languages you may need to be offering the signage in is also really, really important. Make sure that you have good social distancing signage, perhaps putting the dots on the floor that are measured to 1.5 meters space between them, and then also information around the setting explaining why it's important that we maintain those social distancing, just as a reminder to staff that they need to keep that in mind. Think about it now when you start to plan as to how you're going to manage your pickups and drop-offs, again, so that you minimise the contact and make sure that you have your social distancing in place. At the front of your nursery, outside of your building, again, think about the social distancing signage that you do need to have in place there to remind parents. Have you got a shady area so that parents have a space to wait in a socially distanced manner while they're waiting to drop off? Also think about your opening and closing timings. Do you need to take children slightly later than you would normally to allow time at the beginning of the day for cleaning? Perhaps do you need children to leave slightly earlier than they would normally so that you have time to clean your premises without the children on site at the end of the day? Also start to think about how you can register children. Do you have the ability to do this online, perhaps through a suitable app or a nursery management software that allows you to do this? If not, can you email home forms and documents and have them filled in and returned back to you? Again, look as much as possible to have paperless systems in place to minimise that contact with people. Also, it's important that you know that tours should be online. If you need to do a physical tour, it needs to be done outside of operational hours, so evenings and weekends when there's no children and staff on site. Also, it's important before you open that you do communicate clearly to parents that there won't be any breastfeeding on site during this time until these new measures are lifted by the licensing authorities. So parents again have the time to go and plan as to how they're going to feed their children had breastfeeding been their option. So again, just think those things through and make sure that you've clearly communicated this information to parents. It's also important that you note that during this time buses can't be used under any circumstances to transport children, and that parents need to be aware that they must not transport children from other families into the setting. So they can only transport their children into nurseries, again, to ensure those social distancing measures are in place. As we move forward, we're obviously going to have deliveries that we need to take and perhaps even maintenance that will take place in our settings. At the moment, under these current restrictions, maintenance and deliveries need to take place outside of your operating hours. If, for example, you needed emergency maintenance, perhaps one of your AC stops working, you would need to move your children to a communal space. And then before you move the children back, you would need to carry out a thorough cleaning of the area where the maintenance was carried out, and then the children can return to that space. At this time, no volunteers are permitted to be inside the nursery. And if you have outsourced workers, so those are people like your language teachers perhaps, or music lessons, PE providers even, they can't come to the nursery at this time. So again, think about how you services. Could you use them through apps like Zoom and continue to bring them into the classroom through online methods? So again, the children still benefit from their services, but we've just maintained that they stay outside of our buildings at this time. So these measures in Guideline 4 are the responsibility of 4 different categories of people. This information is in the roles and responsibilities document that you'll have. It's the responsibility of the principal, the nursery staff, your cleaners, and of course your parents. Again, we've just gone through many of the different things that you need to consider to put in place. Making sure that the principal needs to make sure that you have those bubbles assigned, that you have those staff in place in case you have an emergency absence that you need to cover. Again, we talked about allocating spaces, dividing up large outdoor spaces. If you have an open plan nursery, making sure that it's divided up with partitions so the children aren't coming into contact with each other, and neither of the staff between bubbles. It is important that you make sure you have good records of the staff that are on site every day, and also if you were to have an emergency maintenance team come onto site or a delivery after hours, you do need to also make sure you keep their details for contact tracing. Within your visitor log, it's important that you keep the dates, the times, the names of the person that's visiting, and their Emirates ID number and a contact telephone number. So make sure you keep logs of all of this information, either as a paper copy or, again, if you have an app that will manage this, put it through the app so you have those records stored. Within the self-assessment document, there are a number of guidelines here and criteria for you to look through. It really is important that as you look at this document, you do reflect on where you are as a setting. Are you in the Met column for them? If you're in the partially met or not met column, you do need to put a plan in place for moving all of those criteria into the Met column. Again, I mentioned in part 1, avoid just ticking the self-assessment document. Think about putting in a date so that you can see the progress that you're making and so you can see how it is evolving. It is a living document. It's supposed to continually evolve and change. And even when we open again, you may wish to continue that document. Even if you've met and things change, you can again add information into it here. As I mentioned earlier, you also have within your 5 documents a reopening plan template. I would strongly suggest that you do download this as a soft copy and you start to complete this so that when you come to the portal, you do just copy and paste over the information. For your reopening plan template, you need to have information ready as an overview of your class lists and your staffing based on the requirements stated. That certainly is the case for ADEC, if you're an ADEC licensed nursery. If you are an MOE or SPEAR licensed nursery, at the moment you cannot accept registrations until you have your NOC to reopen. So what I suggest here is that you provide information of how you will put those bubbles together, and you can assign your staff ahead of time because you do know the age groups that you're hoping to take. You know how many staff you need in each of those areas, so you could provide the staff assignment. And again, just talk about how you're going to group children. Will you group them as 0 to 2 and 2 to 4? Are you going to do it 0 to 1, 1 to 2, 2 to 3, 3 to 4? How are you going to put your bubbles together? And that's the information that you need to put into 4A as your bubbles and staff assignment description. For B, you need to add information on your drop-off and pick-up procedures. So here, how are you going to stagger that so that children arrive and are picked up and so you have those social distancing measures in place? Think here about the timings as well that you're going to operate. So what timings will children be asked to come and what timings will you have them collected? You also, under this section, should be mentioning that parents will not be coming to the nursery unless there is an emergency and they are required to come in. And if that's the case, they come in for no more than 10 minutes at a time. Again, under 4B would be a really good place to mention that and highlight your nursery's policy there. Staff and children arrivals and dismissals. Again, how is the process for your staff arriving on site? How are you staggering staff arrivals? And here, when children do arrive, what is the process? They'll come in, will they have their shoes sanitized, or are they removing their shoes and changing into indoor shoes? You're obviously going to sanitize any bags they have, their lunch boxes. Who's going to be responsible for taking them to the classrooms and receiving them from their parents? When you get to the classroom, obviously you're going to do a handover there, lunch box is sanitized, and you're going to make sure that the child is within their bubble and that their lunch box and water bottle are with them. Those are all important pieces of information. Again, within there, you may want to mention the daily health checks that you're going to carry out on arrival. Within your dismissals, what will be the process? Obviously, the parent will come and they're going to be ready to pick them up. Is your admin going to phone to the classrooms? How will they know when to bring the children out? Who will be responsible for coming and bringing the child out and doing that handover? So under C, that's the kind of information that they're going to be looking for there. Then, of course, it's the signage that will be around your setting. Again, photos or uploaded samples of the types of signage that you're going to have around your setting. Are you going to do it in different languages to cater to the languages of your staff? Again, that's entirely up to you. But just uploading samples of your signage and how you're using it in your setting is important. Under signage as well, for social distancing, you might want to highlight that the signage will be outside of your setting as well, so that you have that social distancing measures highlighted to parents. Under indoor and outdoor space, you are expected to upload a setting layout And on the layout, you need to highlight within that your cluster or bubble rooms, and your communal spaces. And just make sure that those are very clear, which bubbles are using which spaces, and your communal spaces, how are they going to be used and where are they in your building. And then finally, you need to upload a common area schedule. So this is an overview of how you're going to use your different communal spaces around your nursery. And again, making sure that here you highlight the importance of, if it's a communal space being used by bubbles, having it sanitized in that 24-hour gap in between use. If it's your staff room, again, how are you going to manage that? Remember that staff from the same bubble need to take breaks together. How will you manage that in your setting? All of those are considerations to go within your description for common area scheduling. Guideline number 5 is the next one we're going to look at, and that looks at child and staff sick leave and attendance. Again, this is in your guidelines document and it's supported by the roles and responsibilities document. You have within your reopening plan template, and we'll look at that slightly later, the different requirements to upload, and there are some criteria in your self-assessment document to work through. The most important thing to highlight here is if a staff member or a child is feeling unwell or they are unwell, they are not to come to nursery. And under no circumstances should a child or staff member take medication to mask the symptoms of any illness really, but particularly here with COVID. That really is an important message, and you need to make sure that that's in your reopening training for your staff and that you're very clear with your parents on this again before they rejoin you. Should a child become unwell when they're on site, and if they appear to have symptoms of COVID-19, then they do need to be isolated in your isolation room immediately. If they have symptoms that are non-COVID symptoms, then they are able to go to your nurse's room. Parents need to be contacted immediately, and they need to collect their child within 1 hour. And this is really, really important. So again, it might be worth you putting this into your registration form or having an additional form that you highlight to parents the different measures that you have in place for the prevention of COVID, so that again they sign to agree that they are aware that they have to collect their child within an hour if they become unwell, and that they agree that they will do so. Once the child has been collected, the child needs to go to the doctors, where obviously the doctor will then make a diagnosis. If the child or staff member tests positive for COVID, it's important that the nursery is closed straight away and that the Ministry of Health is contacted. The Ministry of Health will then be able to guide the nursery leadership as to the next steps. If you need to notify parents midway through one day, because you've had information that confirms that you have had a positive case within the setting, it is important that you then contact every child's parents and get them to come and collect their children immediately, and that the nursery will be closed as soon as you possibly can. It's important that your staff sick leave policy and your child attendance policy is clearly understood by every stakeholder to your nursery. If somebody is unwell, a staff member or a child, they need to stay home and they must seek doctor's advice. It's also important that they communicate their absence to the nurse, and that once they've been to the doctors, they do communicate what the doctor has said to them. So even if it's a non-COVID diagnosis, it really is important that they do contact the nurse and they do inform her of that diagnosis, so that the nurse can track any patterns of illness that are within your setting. It's important that your nurse keeps logs and monitors all illness of staff and children, and looks for those patterns of attendance, and that these are regularly shared with the nursery leadership and, if it's deemed appropriate, any relevant authorities. Both staff and parents will be asked to carry out declarations on health. Your staff will also be asked to carry out declarations on age and living arrangements. and they do need to provide this information. Within the form that you create, you may want to add a statement also saying that they have downloaded the Al Hosn app. So this is a statement for parents and for staff to confirm that they have the Al Hosn app downloaded. And if they fall into one of the at-risk groups, you need to work out how you're going to move forward. Children at risk should not be registered within your setting, and staff who are at risk should not be working in the setting. So again, make sure that you have methods in place to move forward and support those individuals. What we're meaning here, for example, is if you have a teacher with a heart condition, that perhaps they could then do the online learning from home and coordinate the online learning for you. Just something, again, to think about how you can support them moving forward. It is important that every day on arrival you have in place daily health checks for staff and children. You need to be checking for their temperatures, again, on arrival, partway through the day, and also before they leave the setting. You also need to be asking parents if they've had contact with someone who's had a positive COVID test, if they've been in contact or they themselves have symptoms of COVID-19, or whether they've taken medicine to mask the symptoms of any illness, but in particular COVID-19. Again, you could do this as a paper copy, or you could use your nursery software if it allows you to do so. It is important that you do keep this information and you do log it. Again, it just allows you to identify any patterns, or your nurse to identify any patterns within your setting. As I mentioned slightly earlier in the presentation, if a child shows symptoms of COVID, they do need to be isolated immediately in your isolation room. Again, the same as for staff. If they have symptoms, they need to be isolated. If you have more than one child or staff member who is showing symptoms, how will you manage the isolation of them? So again, it's just a case of thinking through how you're going to manage that process. When you register the children, you may want to consider requesting 2 contacts, emergency contact names and their full details, so that if for any reason you couldn't get hold of one of the parents, you do have a backup emergency contact who you can get hold of and ask them to come and collect the child within that hour. If you have any staff members who have been overseas, then they do need to self-quarantine for 14 days before they return to your nursery. And it is important that you note that if you do have a positive case and you do not report it to the Ministry of Health, as is stated in these guidelines, there is hefty fines and possible prison time. So you do need to have awareness that there are penalties in place if you don't report a case. If you have a child or a staff member who has tested positive for COVID-19, or has been exposed to somebody who has tested positive to COVID-19, they need to report this to the nursery. And the nursery principal will immediately carry out any proper procedures that are required. It is important that as a nursery leadership, you do abide by the contact tracing procedures and you provide the Ministry of Health with all the records that they need for contact tracing of anybody who has been around somebody with a positive COVID-19 test result. If any of your staff or children travel abroad, it's important that they do adhere to all of the UAE authority requirements, and this does include the self-isolation requirements and testing requirements. If your teachers did travel, as I mentioned earlier, abroad over the summer, it is important that you have in place that 14-day quarantine and that they don't return until they've completed that. If moving forward you have people that wish to travel, it's important that they do fill out a travel declaration form before they travel, and they need to submit that to the nursery, and then they need to reconfirm that on their return to the nursery. If somebody is returning from holiday and they have symptoms of COVID-19, they mustn't come into the nursery school and they must notify the nursery immediately and self-isolate. If within your settings there is one case of COVID-19 detected, the nursery will be closed immediately for 14 days and you will not be able to reopen until the whole nursery has been sanitised, no more than 5 days before reopening, and that everybody has returned a negative test result. That's all of your staff. If a second case is detected within the nursery, it would be permanently closed. It is important that your nurse does keep really good records at the moment and that they do report to the nursery leadership any patterns that they've noticed and absence trends. And again, that data gets passed on to the Ministry of Health if you think it's pertinent to do so. So again, here we've got lots of different groups that are responsible. If you look at your roles and responsibilities information, you'll see it's there. Here it's important that you understand that we have in place really good, clear lines of communication and that you're actively encouraging your staff and your parents to share information. As we mentioned earlier as well, it is important that the information that you do share is from those reliable sources. So making sure that you share Department of Health, Ministry of Health, World Health Organization and HARD. Those are really good sources of information that you can rely upon. Make sure that you have in place your nursery staff and parents' weekly declaration forms. And those do need to be completed weekly and retained. If over this last few months your nurse has been outsourced to a hospital, she does need to self-quarantine for 14 days prior to returning to work at the nursery, and she must have a COVID test 6 days prior to commencing work. You do really need to stress to your nurse that they are taking a lead role in the management of health within your nurseries here, and that they are needing to take control if a staff member becomes sick or a child becomes sick within the nursery. They are responsible for isolating the child or the staff member. Again, noting to the leadership that they have a potential case in the isolation room, and notifying parents that they do need to come and collect their child within the hour. There's several criteria also within your self-assessment document. Take time to reflect on your setting and work through those criteria and see how you're aligning at the moment to it, and then plan how you can move everything into that MET column as required. The guideline number 5 in your reopening plan template, there are several documents that you do need to upload. You do need to put in there your staff sick leave policy and your child attendance policy. Here it talks about flexibility in these, again, making sure that the staff are aware and your parents are aware that children do not come to school if they are unwell, and making sure that within those policies you have highlighted the importance of the child being collected within an hour. The importance of a staff member and a child, once they've got a diagnosis from the doctors, reporting it straight back to the nurse so that the nurse can act accordingly. These are really, really important pieces of information to be in those policies. It also asks for a description of how you're going to implement your attendance and sick leave policy. So here, how are you going to communicate your policies to staff and parents? How are you going to make sure that your staff understand the importance of the place and the importance of coming back to you and telling you what's going on? And here again, you need to highlight the importance of having the Al Hosn app downloaded, and how are you going to ensure that staff and parents have done that? This would be where you'll talk about that. You need to also have information for 5C on your daily health screenings. What will you be doing? What kind of information are you going to be recording? Talking about the role that the nurse will have. Again, just make sure there's a good description there, and that you're reflecting on the guidelines and you're showing within your descriptions how you'll be implementing the guidelines within your setting. 5D is about the isolation procedure. Remember that the isolation room does need to be separate to the nurse's clinic, and if you were to have more than one child or staff member that needed isolating, how would you manage that within your setting? So again, a good, clear isolation procedure. But I would also say to you, don't just see this guideline in isolation. So with that isolation procedure, you may also want to talk about the hygiene guidelines and the importance of the PPE that's going to be worn and things like that. So you do show a holistic picture in your nursery of the guidelines coming together. Here as well, you have the return to nursery or return to work procedures. How are you going to manage those things? And last but not least, the attendance trend monitoring. So will your nurse have it logged in a management software? Will they have paper copies that manage the attendance, logging children's and staff's absences? All of that information, how are you going to handle that within your setting? Okay, guideline number 6 is crisis management, and guideline number 6 we have a whole session on. So part 3 of the training looks at the crisis management requirements and looks at the development of your crisis management plan. However, let's just quickly go through some of these guidelines. It is important that you do have in place clear procedures within your crisis management plan. And within that, obviously, we're going to look at planning for pandemics and what happens within your nursery when a pandemic occurs. And we're going to be talking about including in there statements on what happens if there is a positive case within your setting. If you were to have a positive case, we've talked already about the suspension of operations immediately as soon as you have that COVID positive test. If a first degree family member of a staff or child tests positive for COVID-19, then that staff member or the child should be sent home to self-isolate for a minimum of 14 days, and they then need to submit a negative COVID test result before they return to nursery. We'll also be talking in part 3 about establishing a crisis management team that can help support you as you put together your crisis management plan. And within your crisis management plan, you will also have an emergency financial policy that will look at the sustainability of your nursery financially, with things like your payment plans and the refunds that you have in place should you undergo a forced emergency closure again. It's important that you communicate your crisis management plan effectively to everybody, and that you make sure they have good, clear information on their roles and responsibilities. This is your staff within your crisis management plan. One thing that you do need to start thinking about is your communication systems. So again, how do you communicate parent to parents? How do you communicate to your staff? What systems do you use? And now is a good time to test it and check that it works. Again, so you can communicate information quickly as is required. It's also a good time to reflect on your emergency contact list and ensure it's current and up to date. It's also important that you ensure that your emergency contact list is accessible from a remote location. So what that means is that even if you are outside of the nursery, does somebody still have access to an emergency contacts list? And when we talk about an emergency contacts list, I'm not just talking about police, ambulance and fire. I'm talking about your contacts with your electricity and water authorities. I'm talking about contacts of your maintenance people and your fire servicing teams and your sanitisation crews, because those are all going to be contacts that you might need to get in contact with outside of the nursery. So it's important that you have all of those details with you. It's also really important that you make sure you have contact lists for all of your staff and all of your parents, again, that this information is current and correct information. Making sure that you, again, can access that from a remote location. So can you contact your staff if required from outside of the nursery? Do you have their telephone numbers, their email addresses, and the same for parents? Just in case there is an emergency and you can't get to the nursery, but you do need to get hold of those people. It's also important that, again, before you return to nursery, you communicate to your parents the importance of coming and updating their information if it changes, and that is their responsibility to do so. They do need to come and give you that information to make sure that you have everything that you need should you need to get hold of them. Your crisis management plan also needs to have a consideration for if the nursery were to close again, what continuity planning do you have in place? Would you be able to revert to online learning for a period of closure? And what impact would this have on the way that you manage your staff, for example? Have you got in place an idea of the structure that your online learning would take? Have you communicated your expectation to your teachers in terms of how many live sessions they would need to do a day or a week? Do they need to do recorded sessions or storytelling? What exactly will your online learning look like should you need to revert to it in emergencies? And one issue that we tended to find was that when we turned to online learning, our teachers didn't have the resources that they needed to support it straight away. So you might want to consider putting together some teachers' kits, so like bags of resources with art materials in, storybooks, things that the teachers could keep at home so that if you needed to revert to online learning quickly, they already had resources ready to do so. And it just means it's a lot less stressful and that they have everything they need to get started very quickly. So again, this guideline is the responsibility of the principal, the nursery staff, and of course the parents. And it really is important that when you put your crisis management plan together, you do brainstorm with your staff and you go through different scenarios and how you could manage those different scenarios so that they bring ideas that you can perhaps implement into your crisis management plan to you. It's also a good time to think about the medical insurance that you have in place for staff members. They are going to be frontline workers, and as such, you need to ensure that their coverage is sufficient. If you have staff, for example, who are on their husband's visas, have you got confirmation that they have medical insurance? And do you have copies of the medical insurance cards and things like that should you require it? And we talked a few moments ago about online learning. So do you have systems now moving forward to support online learning, something like Seesaw, for example? And are your staff trained to use these different apps so that, again, you can quickly switch into those methods should you need to do so? There's a number of self-assessment criteria here for you to work through. I'm not going to read them for you. But again, just work through those and see how well you currently comply with them. And if you don't, slowly work through them again and plan for how you can meet that criteria. When you're uploading to the portal for guideline number 6, you will need to upload a crisis management plan. You will need to upload your details of your emergency contacts. You will need to give examples of completed risk assessments and the templates that you use for risk assessment. Again, your risk assessments in line with COVID-19. So go around your setting, highlight the risks that there are as a result of COVID-19, and again, how you're going to mitigate those risks within your setting. And last but not least, an emergency financial policy. So that does need to be uploaded, and you can also include that within your crisis management plan so that you have a really comprehensive plan in place should you or your staff need it. Guideline number 7 is all about positive relationships with parents. As early years, we've always been really good at having positive relationships with parents, and now it really is important that we do make sure that we have those strong relationships in place. We do need to make sure that we support parents' transitions to the new normal. It's important that you do have in place a plan. Again, work with your nursery staff to plan what the transitions to nursery are going to look like now for the children that are coming in, particularly children that have not been to nursery before. How are you going to support the parents, and how are you going to make sure that that's as stress-free as possible for everybody? So for the nursery staff, for the leadership, for parents, and ultimately for that child. Again, when you're providing information to your parents, make sure they have those reliable information sources. They're the ones that we've talked about earlier. It is important that we only refer to reliable sources. So again, if you're putting together a parent handbook, perhaps a parent handbook for return with COVID-19 measures in place, then this is all the kinds of information that should be included within that. It's also really important that we do have really strong communication methods in place so that parents understand the expectations that we have on communication and where they can go for information. You may also want to include a parent hotline. So for example, this would be for emergency uses only. If at 11 o'clock at night they have a COVID test come back and it's a positive, again, how can they get that information to you so that you can take the right action in a timely manner? So again, just think through all of those different areas and how you can support them within your setting. Something else you may wish to consider is appointing a parent liaison leader. I just want to quickly mention that this is a staff member, and it's a staff member that consults with parents and makes sure there's good communication, that they're getting really good information, and that they're getting regular communication. Again, if you have somebody that's given that role, it just makes sure that that's consistent. It is important as well that you do discourage parent WhatsApp groups. Often the information that parents share in these WhatsApp groups is unreliable, and it's usually heavily opinion based. Often you'll find that the parent WhatsApp groups do cause more worry than they actually absolve. As you start to look at the transitions into nursery and that you start to send information home to parents, again, this would be another good opportunity for you to talk to them about the importance of promoting independence within your setting, so that they understand why that's going to help you, and give them ideas of ways that at home they can support the promotion of independence in an age and stage appropriate manner. It's also important that you think about how stressful this time is going to be for children and for parents, and talk to them about ways that you can reduce stress at home. For example, things like bedtime stories, good bedtime routine so that they have bath time and stories, and it's a nice relaxing time before bed. And I mean, that also supports stress relief for parents, because it's a nice part of the day to enjoy with your child. Other ideas for promoting those positive relationships with children and parents is yoga and mindfulness. So again, referring them to sources of information that they can support their child moving forward. There are several roles, again, that are related to guideline number 7 that have roles and responsibilities that pertain to this. We've gone through a number of the different measures. We've talked about the importance of getting that transition right as you're moving towards reopening. Think about how you're going to give that information to parents. Are you going to send home a handbook? Are you going to do online parent information sessions and build within those times for questions and answers, and just to clarify any concerns that they may have? Moving forward, it is as important as ever that we do celebrate the successes of the children. Good ways to do this is sending home samples of things that they've been working on, so perhaps an artwork, or if they've made an amazing model from loose parts, again, photoing that and sending that home for parents to have a look at. We're looking at doing this in a paperless way. So at the moment, we won't be sending home hard copies of children's work. We need to, again, look at the software that we have in place, our nursery management software, perhaps thinking about how we can email home information like this to parents, and make sure that they still have those opportunities to celebrate success with their children. When you are communicating information like this to parents from a bubble, it is important that you also set expectations. So will you send home information on every child every day? Is that manageable at the moment with these new regulations in place? Will you send it home twice a week for every child? Or will you do a summary and a roundup at the end of the week and send that home? Talk with your staff teams and identify what can be managed at the moment with the additional requirements of cleaning and all of that that's going on within those rooms, and then communicate to parents what they can expect from you. At the moment, obviously, those relationships are going to be harder than ever to create and then to maintain, because a teaching staff, it's not likely that you're going to have a huge amount of contact with parents because of the way that drop-off may be worked, and maintaining your bubble and the health and safety of the children within it. So think about increasing the number of parent-teacher meetings that you have online, again, so that parents have that time to come and chat to you online and get the information that they may need, and also to discuss with you how the transition into nursery is going and any concerns that they might have. At the beginning of term, you may want to consider your teachers talking to each of the parents individually as well within your bubbles. And when they do this online, it's a good opportunity for the teacher to perhaps turn on their cameras and give a quick tour of the classroom environment that the child's going to be coming into. Again, this is a really nice, reassuring method for the parents, that they get to see their children's class, where their child's going to be going, rather than not having any information and being kept in the dark. So just making opportunities to share online with parents anything that you can. And also, if you are a nursery that has apps and software and things like that, how are you going to train the parents on it? Normally we would perhaps invite parents into the setting and do a session with them on how to use the app and where to download it and what it looks like. It's going to be slightly different this time. We can't bring them into the nursery to physically do that with them. Can we run online sessions? Can we make them information leaflets to support how they do this? So again, just sit and have a think with your nursery staff team how you can manage the use of apps and training parents in their usage. There are no self-assessment criteria for Guideline 7, so you don't need to worry about looking at the self-assessment form for this guideline. And for the reopening plan template, there is just one description that you need to include, and this will look at how you're going to have those positive relationships with parents. So again, think through the entire process, from the time that they register, the information that you're going to be giving them, how you're going to do it in a paperless manner, how you're going to communicate with them, how you'll support the transition into nursery, and then once the child is into nursery, how will you manage that and maintain that positive relationship moving forward during the next term, the next few terms with that child. Guideline number 8 is the one that talks about vulnerable populations. It is important that within your nurseries now you do identify any staff members or children who may be classed as vulnerable. When you're looking to identify your staff members or families and children who may have vulnerable members within them, it's important that you know that these at-risk persons are those with heart disease, diabetes, hypertension, chronic respiratory illness, or cancer. So again, it's time to look at those medical forms, identify any of the medical forms that come in that do have children at risk, but also learning a little bit about the families that you have with you. For your staff, you need to complete a medical form again so that you have the information that you need to make good decisions. Also within your staff form, you need to highlight that you need to have information on at-risk individuals living with them, and this includes those who have elderly parents over 60 years, those having treatment for cancer, those who have their immune system compromised, for example. So you need to highlight that to your staff. Are they living with anybody that falls within these groups? And you also need to highlight this to your parents. Do they have anybody living with them that falls into those categories? At the moment, because children who are in those at-risk categories should not be registered within your settings, are you going to be running concurrently with your physical attendance? Are you going to have an online option for those children so that you can continue to support any vulnerable populations that you identify within your children and their families? And it's important that any of this information on your staff and your children's medical forms go through your nurse, because she has the medical knowledge to identify those who are at risk, and again look at the ways that those can be supported. As I mentioned earlier, any child that is identified as being at risk cannot be enrolled in the nursery, and any adult that is categorised as being at risk shouldn't be working in the nursery environment either. It's also important at this time that we do look at supporting our families. There's lots of organisations out there that we can refer to if we need to. But again, even things like having that online learning that's taking place at the same time as we're doing that physical in-person learning, again, it just allows those children to still access learning and a routine, which is really, really important. If you look at the roles and responsibilities document, there are several people that are responsible for guideline number 8. Again, take time to work through those. It's really important that you understand your roles and responsibilities in line with this guideline. And there are 3 self-assessment criteria for guideline number 8. So again, have a look at these. It's about making a procedure to identify vulnerable children and staff, and making sure that anybody that's medically at risk, that's a child that isn't registered in the nursery, and any adult isn't working within the nursery environment. So again, take time to work through that self-assessment form and determine where you are in relation to those criteria. With the reopening plan template, again, you need to put a short description in here explaining how you're going to support vulnerable populations in your setting. When you're writing this description, make sure that you're talking about the vulnerable populations of children, the vulnerable populations of staff, and obviously if there are any parents, so if you have anybody that's living with those age 60 and over, or living with people who are at risk, how you're going to support all of those individuals within your setting. The final guideline, guideline number 9, is with regards to well-being. We need to understand that the next few weeks and that transition back to nursery is going to be a stressful time for everybody, parents, staff and children, and we need to make sure that we have supported everybody and made sure that we're meeting all of their needs moving forward. The key to this really is communication. It's important that we do proactively communicate as much information as possible. Again, with parents identifying the types of questions that they may ask, and having that frequently asked questions document available shows that you're proactive, shows that you understand the types of questions that they're going to have, and shows that you really do have plans in place to support everybody. Providing your in-house training for staff to ensure that they understand how to support children who have been impacted by COVID-19. COVID-19 has meant something slightly different to everybody. So it is important that your teachers take time to understand the impact that this has had on children and the children that are coming into their bubbles. Think about how you can start that dialogue with parents. So again, as a teacher, you have an understanding of the child that's coming to you and the support that they may require, and any strategies that may need to be in place. It's also important that we remember that our staff are likely to have been impacted by the events that have gone on around COVID-19. So we also need to take time to listen to them and support them as much as we can too. Once we've transitioned those children in and we have a better understanding of the children that we have and their experiences of the last few months, again, start to weave within your lesson planning well-being topics and well-being strategies to support the children. Again, anything that you're doing in the class, make sure you share information with parents so that they can continue to support this at home as well. It's important that we do communicate to everybody that this virus is indiscriminate, and as such it has affected different people in very different ways, and that at the end of the day we are all in this together. Guideline number 9, again, have a look at the roles and responsibilities document. There are several people who do have roles and responsibilities there. Key takeaways here are things like making time to listen to your staff and understanding their experience of the last few months. You know, husbands may have lost jobs. It could be that they've had to relocate, change houses. They may have lost somebody to COVID-19. So again, having that understanding of what's gone on in your staff member's life and identifying ways to support them is really important. We've talked about taking time out as well to listen to children and their families and understanding the impact it's had on those children's lives. And that's really important because that's the only way that we can plan for them to come into the nurseries and get the support that they need and their needs met. And it's also important that we remember that the nursery needs to be a happy place. The children do need to come in and have an enjoyable time whilst we have these strict measures in place. There's 2 criteria on your self-assessment sheet here. So again, take time to go through those and determine where you are. And before submission, all criteria do need to be in that met column. And for your reopening plan template, you need to add a short description here. Again, talking about what you're going to be doing within your settings to promote well-being. And with regards to this description, you do need to make sure that you are talking about the well-being of children, the well-being of your staff, and also the well-being of the parents. So again, make sure that your description covers all 3 categories there. Some final things for you to have a think about. It is important that before we open, we do recognise that as we move forward, bringing in people to carry out maintenance will become slightly more difficult. So going into this and being as prepared for the reopening as we can is really, really important too. Have a think about how your building's been left for the last few months. Some nurseries haven't had any staff in, so it is important that we do things like carrying out a pest control before people return to our sites. Again, your water tank may require cleaning before we return, just to make sure that it's really at high standards. You're going to be bringing in a lot of different chemicals perhaps and new types of chemicals to deal with the new cleaning requirements. Again, perhaps think about creating a COSH system for managing your chemicals as you're bringing in these new different products. Again, while you don't have children on site, carry out a check and test that your fire system is fully functional. Carrying out a check of your air conditioning, because again, if you have to carry out emergency air conditioning maintenance because one of the units stops working, again, once the children are on site, it's going to be very difficult to be moving those children and then cleaning and sanitizing before you move them back. So again, being proactive is good here. When you come to uploading your documents to the portal, you will need to upload licenses. So it really is important that you check that those are in date. And the same, you need to go through any contracts that you have in insurances and just check that they are all valid as well. And finally, things like your water connection. Again, if you haven't been using your nursery building for some time, you may just need to check your water connection and your internet and phone lines and check that everything's functional and ready to be used as soon as the children and staff return. Okay, so that concludes tonight's session. I would like to say thank you on behalf of Kinderley and the Early Childhood Authority for attending tonight's sessions, and also the licensing authorities, so the Ministry of Education, ADEC and SPEA. A quick reminder, if you do have any questions, please do go to the tops of the screens where there is a chat function and you can put your questions in there. Please do mention though, before you put your question, the licensing authority that you would like us to get this information from. To those of you who have put your hands up, I really do apologise. We are not being rude, but we are not able to answer your questions. All questions relating to the guidelines need to go to the licensing authority for their responses. If once you leave tonight's session, or perhaps when you're starting to put together your different documentation and your plans, you realise that you have a question, you can visit the Kinderley website, and it's given on the bottom of your screen, and you can ask your questions there, and those questions are also being put to the licensing authorities for their responses. So again, we will continue to put that information to them, and we will continue to update that frequently asked questions page regularly to make sure that you have the most current information with you. I would like to say thank you once again for attending tonight's session.